Today, I will be again taking a topic from medicine, and this is a topic from which various questions have been asked in your NEET PG examinations and FMGE examinations, as well as NEET SS examinations. The topic today is Guillain-Barré syndrome, and as far as the Guillain-Barré syndrome is concerned, I will be dealing with the most frequent asked points from this disease or clinical entity. So as far as Guillain-Barré syndrome is concerned, you have to remember that we give it the name as acute inflammatory demyelinating polyneuropathy. So if you break up this term, it is usually an acute clinical entity, inflammatory, and there's a certain type of demyelination associated with it, and it affects multiple nerves. So acute inflammatory demyelinating polyneuropathy. Now you have to remember classically that it is a disease which usually follows a GI or a respiratory infection. So there is a trigger point, and the trigger point is a GI or a respiratory disease, and after that the classical entity follows, and this classical entity is the presence of ascending weakness, ascending muscle weakness. That is important. So the type of muscle weakness which you have is the ascending type, and we differentiate it from various other clinical scenarios which cause a descending type of weakness. So that's important. So the trigger point being GI infection and the respiratory infection, and it is more common in males as compared to females. That is an additional point which is frequently asked. So the trigger is the GI and the respiratory infections, as you see, and it is believed that it has got an autoimmune pathology, and predominantly it is a motor neuropathy. So these are some important points. Now, it is not one clinical entity which we say, so there are multiple subtypes of Guillain-Barré syndrome, and you have to remember that one type which is the predominant is the acute inflammatory demyelinating polyneuropathy, and another is the motor axonal type of neuropathy, and the third type is the motor sensory neuropathy. So combination of motor and sensory symptomatology, and another variant is the Miller-Fisher syndrome, which we will be dealing with specifically at the end. So these are some of the subtypes. Now, as far as the organisms are concerned, from the knowledge of your microbiology, and you can be asked this clinical scenario in microbiology as well as medicine, what are the various important pathogens, microbial organisms which are associated with Guillain-Barré syndrome? And you have to remember classically previously it was asked, and you will see an association of Campylobacter jejuni. Important. The herpes virus, the mycoplasma, the CMV, and the influenza A and B viruses as well. But lately it has been found important, which has been asked in the questions from last few years, that HIV virus, the COVID-19 virus, and the Zika virus. So these three, the HIV, COVID-19, and Zika, they are the recent associations found to be implicated in causation of Guillain-Barré syndrome. So that is very important. These set of organisms are most frequently associated with the causation of Guillain-Barré syndrome. And how does a patient with Guillain-Barré syndrome present? This can be asked in the form of clinical scenario. So patients are characterized by the presence of ascending paralysis or weakness after a viral prodrome. So following a GI infection, a respiratory infection, a patient will be noticing weakness is in his or her lower limbs, and then gradually progressing to the upper limbs, and in some cases there might be facial weakness in the form of facial dysplasia. So that is important. So a weakness of a sort which is ascending in nature, and sometimes the cranial nerves may also be affected. So weakness starts in the lower limbs, the abdominal muscles, and the upper limb. And what is important is that it can affect the respiratory group of muscles, which is very severe and very serious, and needs a different, I mean to say, a different clinical concentration, because in case the respiratory weakness sets in, that can cause complications. So weakness starting in the lower limbs, gradually progressing to the abdominal area, then the upper limbs, and then the face might sometimes involve, the cranial nerves might be sometimes involved in addition to the respiratory muscles. So we can be having host of things like quadriparesis in the late cases and ventilatory insufficiency as a result of breakdown of the respiratory musculature and or the paralysis of the respiratory system. And we can have severe ventilatory insufficiency in severe cases which needs immediate concentration. So paraplegia, quadriplegia with areflexia and cranial nerve involvement may also be seen. Now, they ask the criteria sometimes as one-liners. What is the criteria which is associated with Guillain-Barré syndrome? The Brighton term, you have to remember that Brighton's criteria is implicated in this thing. So we have levels 1, 2, and 3. This is beyond your scope at this point of time. Over here now, you can see the imaging, and sometimes image-based questions can be asked from Guillain-Barré syndrome, and you can see there's a signal enhancement. Over here, the first section, the first diagram which is labeled as A, you can see the arrows are there over here, and there is the signal enhancement in the facial nuclear area. And that is one of the things. In the second figure, you can have an increased signal enhancement in the spinal cord, in the medullary conus, and that is there, which is depicted by multiple arrows. And in the third diagram, you have the sympathetic third and the fourth diagram labeled as C and D. You have the signal enhancement in the spinal ganglia. So these are classical features radiologically which can be seen in this. Now, how do we arrive at the diagnosis of Guillain-Barré syndrome? You have to remember that the history is very important. As far as the history is concerned, the patient will be giving a positive history of a GI infection or a respiratory infection. So that's important, and that will be followed by weakness in the lower limb and the abdomen and the upper limb. In case patient presents with cranial nerve dysfunction, you can be testing the cranial nerves and they can show dysfunction. So if you're fortunate enough, there will be cranial nerve paralysis as well, and the physical examination will show weakness in the lower limbs, the weakness in the upper limbs, which can be detected clinically. In addition, there is the CSF. The CSF findings in Guillain-Barré syndrome happen to be a question which is very frequently asked, and you will notice elevated CSF protein levels. So the protein levels of the CSF will be elevated as contrast, in sharp contrast to CSF white cell count, which will be normal, and the CSF cell count is usually typically normal. So protein levels are elevated, the cell counts are typically normal, the CSF white cell count especially tend to be normal. And on nerve conduction, there will be decreased nerve conduction. Very important to mention that there is this decreased nerve conduction. So this is something about the Guillain-Barré syndrome. Now we have got the Miller-Fisher variant, a question which is sometimes asked. And what is this Miller-Fisher variant or Miller-Fisher syndrome? It is a variant of Guillain-Barré syndrome which is characterized by a triad. And what is the triad? There is a triad of ophthalmoplegia, there's a triad of ataxia. There's another feature associated with these two things, and that is areflexia. And so absence of reflexes, ataxia, and ophthalmoplegia. This is a classical triad of Miller-Fisher syndrome. In addition, sometimes you can be having facial weakness and ptosis in certain patients. So this is asked sometimes Miller-Fisher variant of Guillain-Barré syndrome. Now, treatment depends upon the severity of the infection. In many cases, the Guillain-Barré syndrome is self-resolving. There is no need of any intervention and the patient gets well of his own. But in certain cases, you have to monitor the patient and the being spontaneous in recovery. Sometimes once the respiratory muscles are affected, as I previously mentioned, there might be need for a respiratory support. So respiratory support is needed in case of ventilatory insufficiency, and IV immunoglobulins have been found to be very effective, and plasmapheresis lately has been used in severe cases. So we have got the severity which determines and dictates the treatment plan. So we have got most of the cases resolving spontaneously, immunoglobulins, plasmapheresis, and we have got the respiratory support to be given while needed. So this is something about the Guillain-Barré syndrome, and I hope this will help you a lot in answering any question asked from Guillain-Barré syndrome. Thanks a lot.